everyone, I'm Dr. Ellern here. I'm a cosmetic physician at Reflections, and today we're going to talk about cheek fillers. So fillers are something we do super commonly here, and we get so many concerns about how things are going to look natural, and I think one of the biggest concerns is people kind of remember the bad fillers and they don't really notice the good fillers. So we're going to actually go through some pictures today and kind of see what can be done with certain types of treatments we do and how we can do cheek fillers in a really natural sort of way. So we're gonna take a minute here and we're gonna go through some photos. We're gonna kind of play a little game where we're gonna see if you guys can tell what these patients have had done, which patients you think had cheek fillers and which haven't, and see if you can notice the difference between any of these patients. You'll notice each one of these patients, we pick people similar in age just to make it fair. One person in this photo has had cheek fillers and the other one hasn't. So when you're taking a look at them, I think you'll find that it's pretty hard to tell which people have had what done and which people have not had something done. And that's kind of the point. Some of these patients have had sulfate done, some of these patients have had threadless done, some of these patients have had fillers done, some of these patients have not. Some of these are befores and afters for different treatments. And I think the point is here is that when done correctly and done with a delicate hand, cheek fillers can be a great enhancement to your face, and they can really accentuate what you want to without being over dramatic or overdone. All right, so let's take a moment and we'll look at some photos and see what cheek fillers when done properly can look like. Using cheek fillers can create a happier, more relaxed appearance, as you can see in these photos here, and just a perception of being more well rested. One of the other complaints that we get a lot of is people complaining of looking tired, and so we actually use filler to fill the groove that runs under the eye here, the nasojugal groove, which creates that more sleepy, more tired appearance to help refresh that more middle cheek area that a lot of people complain of flattening as they age. This is another example of how fillers can just make your face look more warm and inviting and friendly. You probably can't really perceive that there's any one particular thing that looks good on her face because she just has an overall global appearance of happiness and well-being, and just refreshed appearance. This photo here shows how both a combination of tightening and fillers together can give you an enhanced result, especially if tightening is needed. And Dr. Wicks Harris will be providing a video about tightening procedures coming up, so you can check that out as well. Finally, one way to check if you've done a good job with fillers or if you've have an overdone filler is to have someone animate. So when you're at rest, sometimes fillers look great, and I think this is where we see this Instagram celebrity kind of look where you're doing a standing picture and they look really great, but then when they smile, it looks really weird. And this, I think, is where a lot of patients' concerns come in. So when you smile and animate, it still should have a natural appearance to it. And if it doesn't, some people who have overdone their fillers will need to dissolve some of those fillers in order to regain that more natural appearance. Sometimes the one-step approach of only putting fillers in to correct something is not the only thing that needs to be done. Sometimes, like we talked about previously, other things like tightening procedures need to be in addition to get you the effect that you want. So I'm going to actually provide a link for a testimonial of a patient who's really young who had filler placed that was just overdone and needed to be dissolved in order to give her a more youthful, corrected appearance that she was originally desiring, and unfortunately got overfilled at another location. I think you'll find that most of these photos, it's really hard to tell that they had anything done whatsoever, and I think that really is the point. I think what we're trying to create for our patients is having them look like the best version of themselves for their age that we possibly can, and coming across as naturally as possible so they just look naturally beautiful and not overdone or overfilled or too full or too angular, which I know is a lot of the concerns that we hear from our patients. Okay, so our final point here today would be when we are analyzing cheeks, this can be a more complicated area than many people realize. You need to look at the facial anatomy, what areas of deficiency patient has, what their goals are, what we can do to create a more youthful, lifted experience on their face, and also analyzing for any other treatments that may be necessary to give them the results that they are looking for. It is not something you want to go with the cheapest sort of route on, because most cheeks need several syringes of filler. We do run a special on doing four syringes of Voluma on the cheeks, but some people don't need all four syringes. So many times we can talk about if there's any other areas that we need to enhance the face and adjust there, because Voluma is used as a more deep deposition filler, someplace like the chin or the jawline, cheeks, areas like that is where Voluma is most commonly used. and they can also be used to enhance the appearance. If this is something you guys are thinking you may want to have done, or if you have questions about cheek fillers or any other areas, we'd be happy to see you for a consultation, and we can talk about what will be the right treatments for you and give you a recommendation as to how many filler types and locations you need to get the result that you're looking for. So we look forward to seeing you. Hope you have a great rest of your day.